The Neonatal Intensive Care Unit is a special place at GBMC, one where highly trained physicians, nurses, and other healthcare professionals care for the tiniest and sickest patients with around-the-clock care. I met with Dr. Maria Pane, neonatologist at GBMC, to find out more about this renowned program.
10% of babies that are born typically will go to the Neonatal Intensive Care Unit. So about 400 infants are served in this Neonatal Intensive Care Unit.
Okay, let's see what they see.
Okay.
Okay. Hello.
This atmosphere here now in this brand new NICU is really conducive to a calming environment and very welcoming for families, and we appreciate our families and the patients that we can take care of. So we'd like to involve them in the care and in learning more about their babies. The nurses are really great about education and making sure that that parents really feel comfortable as their baby, their tiny baby, or even their large baby is growing and getting better, that they feel like they can make that transition from here to home, and that's key. The goal is to get home. We have individual rooms for all the families, and that's brand new. And it's really nice because it is bright in here, but we are able to dim the shades because we like to have times when it's quiet and where they can get that day-night environment. So these shades can come down.
And how is this room different from a normal hospital room? Obviously, it's for babies, but...
Right. So this is an intensive care room for an infant. This is a special warmer for infants. So when infants first come to the NICU, they may need to get evaluated on a bed such as this. A heater comes on when this is turned on so that babies can be evaluated. Tiny babies, because we take care of babies that are even less than a pound.
Wow. They
cannot go on a warmer such as this to stay because they'll lose heat rapidly. So they'll go into a specialized isolette called a giraffe isolette, and that puts heat and humidity in that their skin, which is where you lose your most heat, stays stabilized by the temperature and the environment of that specialized isolette.
Is that what we laymen would call an incubator?
Yes, exactly. If a baby was in need of the operating room, because there are babies that need surgery, this can be taken directly to the operating room. You'll maintain temperature. Actually, if you feel it, you can feel the warmth. It's on. We're ready for that next baby here.
It is warm, yeah.
The side comes down also. Most of the time, though, we don't want to release too much heat when we're taking care of the baby. So we will just gently open up these side doors, and then we're able to go in and do an exam. But the nice thing is I can see what I'm doing.
Each room features a kangaroo chair designed to promote skin-to-skin contact and early breastfeeding, thanks to generous donations from the community.
So the baby is put up against the parent's chest, and the mother or father, we have a lot of fathers doing this also, will have that baby feel the parent's warmth and then also listen to the heartbeat and the breathing. And we do encourage parents to speak to their babies. Mothers can also breastfeed in these chairs. They can sleep, but these are graciously donated.
So if it reclines, it's easier for the person to hold the baby close?
Yes, absolutely, and more comfortable for mother and for baby, because it's very important for the parents to have comfort, but these are very specially designed.
The new unit also allows clinicians to focus on each infant's individual needs while facilitating communication, bonding, and integration with the family.
There's a computer behind you, so the nurse can be in the room, or the physician or advanced practitioner entering orders, doing their notes, but they can also be outside of the room, and the way these rooms were designed, there's a window there that they could see in. So parents can have some privacy, but yet still the nurse can be able to see what's going on in the room. We have a specialized drawer here that's refrigerated, so if the mother pumps milk, she can pump right in here in the privacy of this room, place her milk bottles in here until we're able to put it in a specialized maternal milk room that we have.
You've mentioned that a lot of the equipment and things are donated to the NICU, and big part of that donation thing is the upcoming Father's Day 5K. How does that work, and why is that important?
Well, the Father's Day 5K is an annual event. Can you believe we're up to our 31st event? We raise much needed funds for a lot of the equipment that I've shown you today, Don, and also for different programs, educational programs for families, for our staff. It's really our major fundraiser of the year, and a nice way too for our families to come back. They come back with their babies. A lot of families do the actual 5K. Some of them are in their with their jogging strollers, but it's a reunion for us.
Very good.
They come back to see the nurses and the doctors and the respiratory therapists, the social workers. I mean, the entire team.
And we're expecting another big one this year.
We sure are, and I understand we'll have nice weather, so anyone that would like to come out this weekend, Sunday, 8 a.m., starting gate, we'll get going.
Not a runner? That's okay. There's also a 1-mile fun walk and a wellness village with good food and prizes. So come on out to GBMC's campus this Sunday and support the little guys that need it most. For GBMC, I'm Don Scott.